Good afternoon. I want to thank you for joining me. This is your County Executive Ed Day, and we're here for our weekly COVID-19 update, along with bringing other items of interest to you that's happening here around the county. First of all, our numbers for COVID-19 here locally. As of this morning, we've had a mere handful of hospitalizations. We've had 4 people confirmed positive and 1 suspected of contracting the virus, and that is under investigation. This number has been relatively steady of pretty much 10 or under since the end of June. So we're really in a good place right now, and that's significantly down from the experience we had not long ago in April. We were averaging about 400 people, every day in the hospital. Last week we had what looked like what could have been a spike. We did discuss this last week, just as a reminder. That was by and large the fact that we had a lot of basically batching of reports coming down at one time. We had 42 cases in one time that came to the Comcast system, which is the transfer of mechanism for information from the state to our local health department. And thankfully, we looked at it. We saw 6 cases from 6 weeks to 8 days were in there. We had a number of repeat testings that were in there. And when you stretch that out through the entirety of that period of time, it really had a negligible effect on the numbers we were seeing before, which has been about roughly 1% positive infection testing. Just so, again, to reiterate, our health department has a partnership with our Department of Planning. They're able to map out these new cases and watch for any possible clusters or spikes. Health is working diligently through our contact tracing program to identify each and every case, notify their close contacts, and with the goal of breaking the transmission, interrupting the transmission of the virus. That is the goal of contact tracing, something we did very effectively here in Rockland with the measles epidemic back in 2018. But when you see these cases, it reminds us we have to remain vigilant and learn to live with this disease. Just continue to use common sense precautions, which seems to have helped us get to this point. We were once one of the worst hit counties in the country, and today we're doing very, very well. So just again, please keep up your social distancing from people, wearing a mask when you're unable to stay 6 feet apart from people, wash your hands 20 seconds, soap your hands up. These habits seemingly have been effective. So let's keep our community safe and heading in the right direction by continuing to use them. And again, look, this is a fact. This is we're not offering this information to make anybody fearful. There's enough that it's being done in some quarters. But we have to understand we're coexisting with this virus. The virus, we have no vaccine, no natural immunity that we know of. We don't quite understand why some people get hit very hard. Some people are almost asymptomatic when they are testing positive. So treading carefully, treading smartly is very, very important. So again, we use the strategies that we think are working well here, and I believe here, when you look at social distancing, washing your hands, and keeping your face out of other people's faces, for example, that would work for pretty much any transmittable disease. So, it's not rocket science, so it's something I think is important for us to do. Because I think it would work for many different types of viruses or sicknesses. If you want to see these numbers for yourself, you can go to rocklandgov.com, rocklandgov.com. Our main page has links to the maps and the metric dashboard links. They're updated between 4 and 5 o'clock Monday through Friday, so they've been updated right around this time in the afternoon. So with that, I'm going to turn things over to my Director of Communications, John Lyon, who's been fielding your questions today, and we'll get on with those questions and answers.
Okay.
John?
Thank you to everyone who wrote in today. We did receive a couple of questions as well as some just more direct comments, but let's get right to it.
I'm concerned about the direct comments. The questions I can handle.
They were all very kind to you,
Okay.
I will say. So some other elected officials, not as much.
Okay.
The first question we got, why are public school buildings available for private schools to use but not for public school students?
Okay, that's good. That's a good question. Look, each individual school district and their school board is the entity that makes decisions regarding schools. That is just a governmental reality. There's no altering that fact. They must work within the guidelines that issued by New York State in all cases, not just for COVID. But we in county government, nor town government, nor village government has any direct oversight over their activities. You have school board members who are elected. You have superintendents who are hired by the school district, and they report to you, the parent, or the resident. You don't have to be a parent to be engaged and involved in your schools, obviously. So, again, straight out answer, it's really up to the school district. If you are not happy with anything going on in the school, you need to communicate that directly with your school district or your school building manager, your school principal.
And if you're incredibly unhappy, consider running for school board yourself. Then you can have an even more direct role in correcting any issues you see.
That is a very good thought. Absolutely, John.
Okay. The next person wrote in asking about a children's indoor playground and a grocery store where they have repeatedly witnessed people not wearing masks. Right. They wrote that despite bringing it to the attention of managers and local police, nothing has been done. They asked what Rockland County can do to correct these issues. What do you recommend a person in this situation do?
Okay, the one thing I will recommend to a person in this situation not to do not get directly involved. It is not a smart move. I am telling you that as a former member of law enforcement. That is not what you should be doing. Please don't do that, because it could elevate much more quickly than you could ever imagine. And it may not seem logical to you, but when you've been a cop for a long time, you realize just how crazy things can get, and they're not rational. I mean, the example here in Rockland, everybody knows about a situation where a gentleman out with his family up in Garnerville, over at the 7-Eleven, somebody was smoking, and he asked the gentleman to please not let the smoke get near his family's face. The gentleman got into the car and just ran over the family twice. And you all read about that. Was that logical? No. The person had some issues, and there are people out there with issues. So that's one thing you should never do, okay? Again, the things that this person did do, go to the store manager, good idea. The store manager, under the executive order of the governor, is authorized to decline service to anybody who comes into his or her store without a face covering. Okay, fine. Sounds simple enough. Let's take one step further. You're required to wear a face covering when you are medically able to tolerate it and you're over the age of 2. If a store manager speaks to someone and they say, I can't wear a mask, that conversation stops right there, because the fact of the matter is this could be an America with Disabilities Act situation, ADA. There's no requirement of the federal law for that person to explain him or herself to the store manager. So those are going to be odd situations, but understand from the store manager's perspective, if he or she gets into a confrontational scenario with this person, that could bring liability to the store and to the manager personally. So it's something that you don't hear from some government officials because they don't want to tell you the whole story sometimes, or don't realize what the whole story is. So be very, very careful of that dynamic. If you're not getting success with the store manager, whether maybe the manager just doesn't care, or really does not really want to be bothered, or is afraid to get involved, you should look to write the ownership or the corporation. That's one thing you could do. Local police are specifically authorized to enforce the governor's orders. If you are not satisfied with a police officer's response, first of all, I was just talking to him or her. Sometimes there are things you're not aware of. If you're not satisfied there, you can speak to a police supervisor or village mayor or town supervisor, depending what police agency did respond there. And it's a matter of accountability. And again, you may not be getting the whole story. So, look, pretty much most people are complying with this. You're going to have people who are not going to do it. I don't think we're going to foresee someone being told by a police officer, put your mask on or else I'm going to arrest you. That's not what the concept here, as far as the governor is concerned, is. But the governor does expect compliance. There is accountability here. Police officers are accountable to their agency and the supervisors. The police departments are accountable to their government entity, whether it be a village or town authority, and those supervisors and mayors are accountable also. If at the end of the day you are unhappy with what's happening, you can give the governor's office a call at 518-474-8390, 518-474-8390. 8390, because at the end of the day, these are his emergency orders, and he's made quite a ballyhoo about wanting local officials to do their job. That is chapter and verse of how this works. And again, as I said, the specifically law enforcement is the entity that's empowered to enforce these orders. Now, health department, I've heard some commentary that came in a bit critical of the health department. Let's be perfectly clear here. The health department can only take action on things that are prohibited by the sanitary code that we regularly enforce. So don't take it out of the health department. That is not their job to do. There are things that they can do. We do work with local municipalities, just so everybody is aware of this. We've had a number of instances where towns or villages have gone into a location. They have found issues. They issued cited violations for. We responded with the police department and with the building inspectors, we mean the health department, found additional areas that fell under the domain of the health department, and action was taken there. So we do work together. There are specified limits and there are specified actions that are empowered for each agency.
And one thing I'd like to personally add to this question, if there's a store, and this has happened to me, where you go and you see people who aren't wearing masks or aren't social distancing or something that is upsetting or you feel isn't safe for you, I haven't gone back to places where I've seen that. So I would recommend just don't go there. Shop with your feet. That's what these store managers will eventually take notice of.
And let the store manager know why.
Exactly.
You know that you have a powerful weapon there. It's your dollar that you're spending there, or more, obviously.
Exactly. So the last question we got today, and this came more in the form of a comment, but what is your response to the thought that the governor has too much control over businesses in New York State, particularly now that it seems that New York has successfully flattened the curve here?
Yeah, look, I've been very clear about this. As of right now, I look at the governor's trying to do, and I do respect his office. I respect the work he has to do. But he's trying to remain, in my view, and again, my background also is in emergency management, is in crisis management, so it's not like I've never had the helm, so to say, in this kind of situation. I believe he's trying to remain in control too long here. He's not reaching out as much as he should be, in my opinion, for his field generals, the county execs, and other elected leaders in the state of New York. It's very difficult to run a war from one foxhole, frankly. You need to go out and get conditions from the field directly to you, because what is good for Watertown is not the same for Orange County. What's good for Buffalo is not the same thing for Rockland County. So there are vast differences in this state. I want to be very clear. I've given credit to the governor for his early actions. I'll re-emphasize that now. The plan that he put out, the phase 1, 2, 3, and 4, made sense for the opening, but the fact is there are still entire industries that are unable to reopen. That is just wrong. That is not what the plan was. I'll be very clear about that. I will continue to push with the other Mid-Hudson region county executives during our daily control room calls. We had a couple of points we brought up today to them, until all businesses are reopened. All I'm insisting upon doing here is what was promised. What was promised was a phased-in reopening of our economy. We were also very clear that if we saw any spikes, any issues that were attendant to that reopening, part of that reopening phase or industry, we would immediately start closing the valve down. We have the capabilities of doing that. It has not happened yet. So we went from phase 1 to 2 to 3 to 4. We are in phase nowhere now. But I am heartened to see over the last week or so, John, I think, we're starting to see some movement out of Albany from the governor. I hope that's the beginning of where we should be, and it was just maybe a minor burp. So hopefully we start moving a little more quickly. Again, always judiciously. People first, safety always. And that is just the way we conduct ourselves here. That's how we make decisions here in Rockland County.
And I'd like to interject again, the people who are out there, the business owners who are out there who aren't able to open, who are upset, or people who are looking for a service that they can't get right now, please contact the governor's office. Reach out to them. We appreciate hearing from you, and we pass that message along, but hearing directly from the people involved is very powerful.
Yes,
we recommend it.
That's a great point. And again, the governor's office is 518-474-8390, 518-474-8390. And again, let us not forget something else. The vast majority of the people who have these businesses are your neighbors, part of Rockland County. So we're in a fight for our own community here. So never let lose sight. These are the people who support our local sports teams, who buy journal ads for things that are special to you, make donations to special causes, things of that nature. And something I always mention, when you hear that fire alarm go off and you see a couple of people leave the local store, that doesn't happen to all corporations. It does happen for local businesses as a matter of routine. So let us not forget the contributions that are being made to support our volunteer forces in so many different ways, including letting them get out to maybe get to your home and deal with any kind of potential emergency. There's a couple of items I'd like to mention today also. First of all, I'd like to thank everyone who was able to join me in donating blood last Wednesday at our county blood drive. We had 69 donors taking part, fantastic turnout. We also, our donations will result in total as many as 225 blood components, that's red cells, platelets, and plasma, entering our community and blood supply and going on to help improve so many lives, as many of the 225 patients and their loved ones. You have to have seen situations or listened to testimony of people who have been in a situation where they needed constant transfusions to survive getting off an operating table. It happens with the bat of an eye, and you find out often too late how important the blood supply is. The New York Blood Center has told us that nearly 2/3 of the blood drives in our area have been canceled due to COVID-19 pandemic. And with many schools and colleges operating remotely, even more drives they feel will be canceled in the future. Anybody who's been paying attention to anything coming out of his office, frankly, as it relates to blood donation, knows that we routinely do have blood emergencies. Think about having 2/3 of our drives canceled when we typically have blood emergencies to begin with. It really, we're up against it. So we're stepping up our response here. We're going to be hosting another blood drive on Wednesday, September 30th. Those who just donated blood cannot donate blood at this one, obviously. You have to wait 58 days, I believe it is, between donations. Yeah, I do count because I do give blood regularly. And this is going to be up in Building A also?
Yeah.
All right, so again, our county employees, God bless them, they'll be helping out with that issue too up at the Pomona Complex. So September 30th on a Wednesday, stay tuned, we'll get the information out to you, obviously, on our Facebook page. And after the video concludes, we'll post a link to help you sign up for this drive and look up for other donation options in your area. Look, Rockland County has had a long history of looking out for friends, family, and neighbors and stepping up to help when they were in need. I ask any of you who are able to donate, please sign up and make an appointment for next month's drive. You're doing a great thing for your community. You're doing a great thing potentially for your own family and loved ones. So it doesn't hurt. It's not a big deal. It really isn't. They give you cookies and orange juice afterwards. So you get like something. Well, it'll be a meal, I guess, under the governor's orders. With that.
I don't know if it qualifies as a meal, but there are snacks.
You'll get it. You'll get a snack, Oreo cookies and things. Well, good stuff like that. So you get to get your chocolate cravings out of the way. Also, while you're at it. One may wonder, why am I smiling so much today, given the craziness we've been dealing with COVID-19 and the fiscal hit our county is taking. Moody's Investor Service yesterday upgraded our bond rating from A2 to A1. Now, remember, Rockland County only 5 or 6 short years ago, our bonds were rated one step above junk. That is how bad things were. To receive this type of news during a fiscally devastating pandemic is absolutely incredible. We were, in my office, we were just absolutely stunned that they were paying attention to this stuff, given what's been going on. But it speaks to the work that we all here have been doing over the last 6.5 years, and that includes people in the administration, our commissioners, our employees who have been able to make more with less happen here in Rockland County. Some don't even realize that we have a 22% lighter workforce now than we did in 2014 when I came into office. We're leaner, we're more efficient. It's about 470 fewer employees in Rockland County government than there were when I entered office. And At one point, we had about over 3,000 employees a few years back. So your county employees are doing a heck of a job delivering services, making sure you get the services you need effectively and efficiently. But the bottom line is Moody clearly approves of and believes in the proactive steps we've been taking to limit the fiscal damage caused by the COVID-19. And this shows you must continue down that path by implementing the comprehensive plan and resolutions that were submitted to the county legislature last week. Let me preface that with just some facts here. Back in March, we saw that the potential of a major hit was there. We immediately moved into action. We ended up instituting a hiring freeze except for critical workers. We implemented an austerity budget. Our county auditor got us on FEMA's reimbursements portal. We're the first municipality, I believe, to even get to that. We looked at departments who had budgets already in place, and some changes were taking place because of COVID-19. We identified every dollar we could. We came up with $18 million in cuts out of this year's budget on funds that were not expended largely because of COVID-19. We looked at vacancies that were still not filled in Rockland County. There were 18 of them. We went to the department heads. We felt that these were jobs that we did not need right now. If we want to visit it later on, maybe a year down the road, that's a whole other story. We eliminated those jobs. That was nearly a $1 million cut. So your county government, before anything hit the fan, identified $19 million worth of reductions in addition to other reductions. So well over $20 million worth of dollars in value that were reduced from this budget. The resolutions I submitted is part of a fiscal package. It's not just a let me react to something. Oh my God, something happened. Let me raise taxes. Let me do this. Let me do that. No, this is a planned out exercise based upon experience, which I'll get into in a little bit. The resolutions call for three things. Number one, the sale of the Sane building. That will bring in cash for this year or next year, whenever it comes in. It'll go to that ledger and that budget. A temporary addition, and temporary I mean temporary, with the resolution's written up with a sunsetted date on it, for about 2.5 years worth of a 0.5% increase in the sales tax rate here in Rockland County. And the other part of it is allowing us to have 3 more weeks of time to submit our proposed budget to the county legislature. It used to be October 24th, I believe, October 23rd. It is changed October 1st in the 2015. We need as much time as possible because obviously with the businesses not opening and our revenue projections, which are very important, we want to be as accurate as possible. This is one of the reasons why we got out of the mess we were in so many ways, because we were accurate and conservative in our budgeting. So we're asking the legislature to give us 3 more weeks to work through that. Again, that's a little bit of an inside baseball scenario, but it's very, very important. We're looking at doing things in the least onerous and least impactful ways possible. Nobody can reasonably expect, looking at a pandemic hitting us the way it has hit us, businesses closing, looking at a $40 to $50 million hit in this year alone, potentially $8 to $20 million in additional cuts in the state of New York. We don't know how the economy is going to recover. There has to be a cost somewhere. We have to find ways of getting from where we were up off of where we are into the place where we should be. And this economy is going very well. This should have been an easy year for us economically. It didn't turn out that way because of things that are outside of our control. It's called an act of God, folks. We cannot control a disease like this, but we need to work through it. I'm going to quote here one of the reasons for the upgrade Moody's Investor Service gave, in their opinion, given management's conservative budgeting in recent years, particularly for sales tax revenues, reserves have improved significantly over the past 5 years, ending fiscal year 2019 at its highest level in nearly 20 years. This is how we got to where we are. And Moody's, again, is not tied politically to anybody. They're calling it as they say it. But this upgrade is, again, as I mentioned earlier, is the result of the work of many people. Again, I want to thank our hardworking employees who have learned to do things differently. We have a lot of changes here in Rockland County government, often more efficiently over the years. It is thanks to their efforts, and we're able to provide a high level of service to residents during this pandemic. Remember, the frontline workers you're talking about, some of these folks were your frontline workers. But by continuing to work together and take proactive steps, I am calling for, I have no doubt, will overcome the current challenge and will emerge stronger than ever before. The Moody's opinion also noted the biggest issues we're facing in 2021 are sales tax and state revenues, but concluded by writing, given the renewed focus on conservatism in budgeting, we expect management will be willing to make the difficult decisions necessary to put together a balanced budget. And yes, you can take that to the bank. We will continue on that path. But to be clear, and this is what drives me here, you will recall we came into office in 2014, but going back to 2008, there was a movie back then, and the movie was the oncoming recession and the proactive steps that were not taken back then that many of us in the legislature pled with the administration, previous administration, to do as we headed into a fiscal crisis. Start taking steps early before it hits us and before it gets worse. That did not happen. That is not the way we're doing things here right now. Because what happened back then was a downward spiral that resulted in double-digit property tax increases, which you're not hearing me talk about, obviously. Those increases were 3 years running. The county property tax went up for 2012 by 30% in 1 year. Think about that. The second year, 18%. The third year, 11%. That is what happened when the situation was ignored. That is not going to happen now. That is not, we did not do all this work to get to where we are to have this collapse on us again. We ended up at a $138 million deficit. It nearly bankrupted us. We almost was taken over by the state of New York. And we had the distinction of being the most fiscally stressed county in the state of New York. Horrible, absolutely horrible. That's what we started 6 years ago. And as I mentioned earlier, we've already made cuts to the budget. We're up in the vicinity of $20 million. The bottom line is this: doing nothing is absolutely not an option. As the ending of the movie 12 years ago would then be the same. We don't want that movie to end that way one more time. That, ladies and gentlemen, is not the reason why we fought so hard over the past 6 years to stop those tax increases, bring over $8 billion of tax-paying rateables to this county, and we became one of the strongest economies in the entire state of New York. That is where we belong, and that's where we're trying to stay right now. So we're going to get through this, okay? But we need to take smart fiscal steps. And I would just offer this. My administration, the people who work around me, who have given us some great advice, given us some great guidance, we've gotten it right. I think anybody of a fair mind cannot disagree with the fact that we've come a long way, and we have really made great strides. Some would say beyond all belief, we've turned this county around. We don't want to lose one step. So I would simply say to my friends and neighbors out there right now, give us a little bit of trust on this one. We've done a good job so far. That's what I'm here for, to make sure that our county government does the right thing for all of you, and that we get to the other side of this unscathed. But again, I want to thank you all for joining us today. We're going to return next week at the same time at 4:15 p.m. to answer your questions. And until then, have a wonderful, wonderful week.